May is Mental Health Awareness Month. Denver 7 is committed to bringing you stories and information that can help you and your family navigate mental health conditions. And part of that is reducing the stigma of mental illness and supporting those affected by it. Joining us now is Noelle Lefforge, the Professional Psychology Clinic Director at the University of Denver. Noelle, thank you so much for being here.
Oh, thank you so much for having me
here. All right, let's start with these stats that are troubling. 1 in 5 adults each year experiencing mental illness, 1 in 6 youth. So let's focus on youth. What are you seeing and what can we all do to help?
Yeah, it's such a great question, and really Colorado struggles in this regard. We're 44th in the nation when you look at prevalence versus access to care, particularly with youth struggling. We saw those spikes during the pandemic and we just haven't really recovered.
There's also a shortage of mental health professionals and treatment facilities in Colorado. So what's going on there, and then how is this impacting access to care?
Yeah, absolutely. In some ways, Colorado does better than a lot of other regions with mental health providers, but we have to look at who's getting care. And if you are willing to pay out of pocket and you can afford that, you probably can find someone who delivers that. But most people can't. And so when we look at our populations, we look at folks who, for example, rely on Medicaid or don't have tons of money to spend on mental health. That's where we really see shortages.
And there, you all, do you have some clinics to fill this gap?
Absolutely.
A lot of them are open to the public and a lot of them really very low cost.
Yeah, so I oversee our GSPP clinical services. We do accept Medicaid. We're one of the largest providers of outpatient behavioral health for those populations in Colorado. And then we also have a sliding scale rate where we're willing to see anybody at a rate that they can afford. We offer specialty services in addition to your typical adult, individual, or group therapy. We serve children, families. We have our STERM Center, which is for military-specific populations, and we have our Trauma Disaster Recovery Clinic, which particularly serves refugees, survivors of torture, and we have our Cub Clinic, which really serves young kiddos and their families.
You guys really have a lot of options there.
Yes, we do.
Part of this is, and to even get to that point of reaching out for help, is reducing the stigma.
Yes.
How can people open up those conversations about themselves, maybe people they're concerned about?
That's such a great question. I think that one is being motivated. The sooner that you get help, the better it is to really have the outcomes that you're looking for. So it is a big hurdle to overcome to make that first call to look for those services. But I hope folks know that we're waiting on the other side. We're not there to judge, we're there to help.
That's right. All right, Noelle Lefforge, thanks so much for this and for what you're doing there at DEO.
Thank you so much.
Thank you.